just like we do for hydrotherapy, shoes off. And they're gonna be here for about 14 to 15 minutes, so I like them to be comfortable. Okay, so positioning is really, really important here. What we wanna do is we'll remove the bolsters for now. What we wanna do is this first belt, the top of the pelvic rim has to dissect the middle of the belt. So a lot of my interns mistake the ASIS for the pelvic rim, but that's so much lower than the pelvic rim. So what I do is I locate the pelvic rim, and then I have the patient lift their hips up and back down. I position them on the belt first before I position them on the table. So right about there, right in the middle, right? We're going to cinch by really tight, nice and tight. You gotta pull nice and tight. So some doctors go take a deep breath in, blow it all the way out. As they exhale, go really tight. From there, we get the belt on. So we get the belt, cinch this, and the O-ring has to stay in the midline because that's where the patient is going to be pulled. So what I do as a secret, I actually, if you push down here, it cinches a lot easier. So I push, pull down, and then just make sure that's in the center. And then I test. As long as that's not so loose it's going all the way down here, that's fine, okay? So now I always have the patient keep their knees up. That way that ensures that I always keep this belt at midline. Because if it's skewed and the belt is not at midline, you're gonna be pulling them from the side. So that's a perfect setup. Now, the bottom of the glutes should never pass this line. So I'm gonna have, as I pull the patient, I'm gonna go, Clara, move down on the table, come towards the foot of the table, a little bit more, right there. Perfect, stop right there, good. So now, you take this, you hook it underneath, hook it underneath here, perfect like that. Rope, some people actually release it all the way and keep it like that. We're gonna be pulling it, so we're gonna be using this table all day long. I just keep it hanging, okay? So you got a rope release, so you gotta hold onto it and then pull, okay? And then let go. Once you let go, it locks. So you have to keep on holding the touch screen. And then clip it in. You can clip it in from the bottom, you can clip it in from the top, it doesn't matter. I would hold on to it as you hit the rope release and take the slack out, because if you don't, it slams. And then if a patient's really acute, even that little bit of tug, it can cause some pain, okay? So knees up, good. So at this point, patient's positioned on the table. This crisscrosses as an X, and we're placing it right underneath the inferior rib cage. So from here, crisscross, take a deep breath in, blow it all the way out, good. And then right in there, and that holds them in place. All right, so they're positioned, she's positioned perfectly. At this point, we can put the knee bolsters so they're able to relax, and make sure that the bolster doesn't go on the actual strap.
Got it.
Right? So make sure there's enough room for it to pull through here. Good, so that's it. Now, table's low, she's okay. I like the patient to rest their foot a little bit, so I'll raise that up a little bit. On shorter people, you got to raise it up a little bit higher. People with really long legs, you may not even need to do that, right? So that's just kind of a thing there. This is lock to the left, unlock to, or lock to the right, unlock to the left. You got to make sure. If you don't unlock it, the table doesn't open up. They'll still get traction and get some benefit, but they're not going to get the full benefits. This tilt is anywhere between the number 8 and 10.
Oh, I see them there.
Yes. Now, for efficiency's sake, just keep it there, right? Rather than bringing it down and bringing it back up
Yeah.
for the next patient. Okay, perfect. Now, this is the most important part. Typically, we're going to address L5S1, which is 10 degrees. How do you know you're at 10 degrees? When you come here and you look at the rope from down here, and all the slacks out, that's not 10 degrees.
No.
So we got to raise it up.
Okay. So
But
we're
you
raising the
also got to
table.
remember to take the slack out and let me know when we get closer to 10 degrees.
Okay. Almost there.
And then take out the slack.
I think it'd have to be there, so.
Good. Now, that would be L5S1.
Okay.
If we wanted to do L4, L5, that would be 18 degrees,
Oh, okay.
right?
I gotcha.
L3, L4, that would be 25 degrees,
Got it. Okay.
right? But 80% of the patients, we're doing 10 degrees. When in doubt, just do 10 degrees.
Got it.
Yeah. So let me know when I'm back at 10 degrees.
Okay. Keep going.
Okay.
I can hit it for you if you want.
Yep.
Okay.
And you'll get to a point where you kind of know where the table kind of falls.
That's pretty good right there.
Yep. Perfect.
Does it have to be exact or?
Doesn't have to be
Okay.
exact.
Okay.
Yeah.
It's probably like
Now
a degree
this
off.
is the most important part. You want to set the computer up, right? You always hit the white button. White button, retrieve protocol,
Oh, very good.
lumbar. It's already preset for you.
Nice.
Now there's 5 settings. There's acute, subacute, decom light, range of motion. We're typically going to be doing decom. It's already set,
Okay.
and it's all the parameters are set here. It starts at 70 pounds of pull, right? We're going to hit enter now, and we're all set. If you want to start at this point, you have to hit. It's weird to get to the actual screen from this preset. You have to hit edit to get here,
Okay.
and then you hit start. And if you hit start, it starts going through its cycle. Now here's the thing. If she was 200 pounds, I would probably start her at about 85, 90, right? Because a lot of patients, their first few visits, like, I don't feel anything. That's good. You're not supposed to feel anything, right? We're going to increase the weight 5 pounds at a time until we get to 50 to 60% of your body weight. I used to be really conservative and the max was 50. Now I push it to 60% of the body weight. I'm seeing much better benefits and much better results. How do you change the weight? You always want to change the top number proportional to the bottom number. So what is your setting? 70. So she's 70-40, right? So, but if someone was, let's say, 200 pounds and we got them to 50% of their body weight, top would be 100. What would bottom be?
70?
70.
Because it's always within
Exactly.
30 degrees?
It's all
Okay.
proportional. Yep. 70. Back. Start.
Okay.
Yeah. Now, here's the, at any point they feel too much pain being pulled, they can press the red button and it stops everything.
Perfect.
Okay, and then you'll get an alert and you hear it beep and then you can come and address them. Okay. This, for smaller patients, they tend to get pulled. So if someone's like 115 pounds, which we get patients that are 115 pounds, starting at the default of 70, that's already a bit too high, right? So this prevents them from slipping because they can hold on. But for small patients, for someone that's 115 pounds, 120 pounds, go decom light. And that presets to 55 pounds.
Great.
Right? And if you want to add 5 pounds, you can just go here, edit, and change that to 60, and change that to 40. And do it that way. Now, the great thing about the T cards is we are writing the top and bottom number down on each day of the visit.
Got it.
So, and you'll did we give her a sample? We showed her a sample?
Mm-hmm.
Yep, good. That's it. That's it. It's you as the doctor. Hey, so we'll start at close to 50 pounds of their body weight. If they're really acute, then we'll start them at an acute level maybe, it's only like a 5-minute session. So I just go decom, but just go really low on the weight. But patients tend not to feel it so much. They have this conception like, oh, I gotta really feel like I'm being pulled apart.
Right.
That's not what you want.
Yeah.
Right? You're gonna feel a tug, and internally you are decompressing.
Yeah.
Right? So you gotta kind of reassure them that it's working. We don't want you to be in pain.
Right.
Any questions? I know you've done this before. All kind of seem familiar.
Yep.
Yep.
Yeah, this is exactly the table we would use in the same settings.
Yep. So, no, it's not going. So what I would do is, hey, Clara, like, how'd you do on the first visit? Were you sore at all? I wasn't sore at all. Great. Let's go up 5 pounds. Next, go up 5 until you get to the point where they're at anywhere between 50 and 60% of the body weight.
Okay.
You don't want to go more than that.
Yeah.
Right? Or if there's a patient that ends up like this, in between this, that's way too much.
Yeah.
Right? And for some reason, some patients, I don't get it. Like, some patients, they tend to get pulled down. Some patients are on their phone, and some patients fall asleep. So they end up like, doing that. So,
Patients use these handlebars.
That's what we used to use.
Yeah.
Yeah, they would hold if they wanted a
they
deeper.
can hold
Yeah.
and pull a little bit to get that extra decompression. But you do this a few times, and it's really the doctor part is where I want to increase. Oh, let's decrease it. Let's increase it. Let's get you to 50 to 60% of your body weight as quick as possible, so you can get the great best results.
Perfect.
That's really it.
Good.
And you do this a few times. I mean, Mario can do this with his eyes closed.
Yeah.
So, but everything should be done under the direction of the doctor.
Yeah.
But Mario can come up and go, hey, doc, do you think we can go up today?
Got it.
And go, yeah.
Perfect.
Let's do that. So
Okay.
that's it.
Very good.
Yep.